for us. And probably what's going to work best, and I'm going to do my best to kind of monitor the chat. Mackenzie Collins, one of our PT students, has agreed to kind of help me out managing, letting people into the room as well. So thank you to her for that. But basically, we're just going to jump right in here. So thank you all for joining. So this is thoughts on exercise as we age. And, I chose this opening picture for a reason, not just because it's pretty, but because I kind of think of a hot air balloon being similar. And I think it does a nice job capturing the relationship between kind of this healthy aging and physical activity and exercise. So, at a very basic level, heating the air in the balloon makes it rise, similar to like exercise and activity improves our health. In the hot air balloon, when you turn off the burner, you can maintain your altitude for just a little bit, but then you start to kind of descend. And it's similar with exercise and activity. We can have small periods where we can stop our normal routine, but we will start to descend or lose altitude on our fitness level. And so it's kind of important to think about that as we go through this and look at this topic. So just quickly, here's a little blurb about me. I joined the Hanover DPT faculty in 2021, June to be precise. I've been practicing since 1998. I went to University of Evansville, got a Doctor of Health Science from University of Indianapolis, but I've been down here in Texas for almost 25 years now, so since 1998. So evidently there is a fountain of youth that's in Florida. Unfortunately, aging is universal. It's inevitable, and it has this decremental decline. The closest thing we've really come to the fountain of youth is this trifecta of healthy eating, appropriate amount of sleeping, that quality sleep, and moving often. Today, we're going to focus on that moving, that exercise, that physical activity portion. Unfortunately, somewhere in your 20s and 30s, the aging process commences. It decrementally declines over the next 6 to 7 decades. So with that, I'd kind of be remiss if I didn't start with some sort of pre-participation screening. And so this is an easy way, if you're not used to physical activity or exercise, this would be just a screening tool that if you answered yes to any of these, you need to go see your physician or some other healthcare provider to kind of give you that clearance that, yeah, it's okay for you to participate in exercise. There's other ones out there. PAR-Q may be one that you're familiar with. That's another common one. So we're going to talk about 4 or 5 main things. Properly dosed exercise is medicine. And so really kind of the question is, why are we not specifically prescribing exercise more often? We're also going to talk about, doing something is better than nothing. And if you're doing something, add some variety to it. There's variety is the spice of life. And then if you're doing those things, high intensity tends to be better than moderate intensity, and it for sure is better than lower intensity when it comes to strength training, aerobic training, different type of activities like that. For the people who are just kind of joining, if you do have questions as we're going, just kind of type them into the chat, and then we'll have some time at the end for questions as well. I just wanted to start with where the current guidelines are with older adults, and I put adults as well as children, adolescents as well, just for comparisons. But we're really looking at 150 to 300 minutes total per week of moderate activity, 75 to 150 if it's kind of that vigorous or higher intensity. And we'll kind of define those terms here in a little bit. It includes strength training, and I really like that they more recently have included balance interventions, although I think we can make a good argument that any adult, and probably any child, adolescent, needs to be working on balance. So I have just a couple kind of those nerdy slides in this presentation. So here's the first one. So sitting or being sedentary is bad. And so they've looked at this. They see that there is this relationship, direct relationship. The more that you sit and the more that you're sedentary, you do have increased cardiovascular disease, diabetes, different cancers. And that's what you see on the left. On the right, what's interesting is this is where they get that 150 to 300 minute, which I know is very small. But if you look at this portion right here, this is where you get the something is better than nothing. And so the people that actually benefit the most from exercise activity are those who aren't doing anything. And so that's why something is better than nothing. You may have heard that sitting is the new smoking, and in some ways it is, some ways it is not. When you look at sitting like 8+ hours a day, there is an increased premature death rate of 20%. But if you wanted to compare that to smoking, it's 180%. So it's bad, but it's not quite as bad as smoking. So why is this important? When you add getting older with a sedentary lifestyle, you end up with decreased muscle function, decreased cardiorespiratory fitness, or that aerobic capacity. Why is that bad? Well, decreased function, your decreased capacity to kind of perform those, those daily activities. It may be something bringing in the groceries, or making it to the restroom, or how much energy it takes to take a shower or to bathe. As we continue to go down that pathway, we can start to lose our independence, which, if you ask most people, they would probably say, the vast majority would say they want to maintain their independence as long as they can. There's a couple of different ways you can look at the ability to do things. This is just one model that has 4 categories. I'm not going to bore you with defining fun, functional, frail, and failure. I think the icons on here kind of do it justice. You guys can figure out, what happens on each one. I do want to mention, like most things, going downhill is often easier than going uphill. And so that's why it's important to kind of keep that exercise going. And so we can keep the altitude in a hot air balloon by doing the exercise, the activity, staying functional, staying fun, getting out there, hiking, traveling, playing with grandchildren, those type of things. So let's define a few things. You've heard me mention vigorous intensity or high intensity a few times, moderate intensity as well. And here's this one way to look at that. One of the easier ways to look at that is this perceived rate of exertion right here. So the moderate is your kind of, and we'll define this a little bit in the next slide. And then the 7 to 8 would be you're working pretty hard at that. You'll also hear me use exercise and activity, and I kind of use those interchangeably. There is a difference. Exercise is more structured, more planned, more repetitive. And so if you're an exercise person, great. If you're an active person, you like to hike, you like to go out and do yard work, it's something, movement is what we're really looking for, something that improves our overall fitness level. And the next slide, I have some examples of what moderate intensity, some examples, what that might look like, as well as some of the vigorous activities. There are other ways you can do that. You can get as specific as, doing a target heart rate range if you like to get that specific. I think the talk test is a nice, easy way to figure out how hard you're working. If you're able to carry on a conversation, but you really can't sing a song, you're probably at around the moderate intensity level. But if you're really working hard at that high intensity and you can only get a few words out at a time, then that's probably going to be that higher intensity, that vigorous intensity, where you're burning more calories, you're adding more stress to your system. If you really want to see some different things, there's this Google site, and I will, for those of you who are joining a little later, I do have slides, and so I will put them in the chat once I wrap things up towards the end, and so I'll have some of these references down there. But you can go to this Google site, and they just have a big laundry list of examples of different vigorous activities, moderate intensities as well with that. Again, here's one of those nerdy slides. I just wanted to quickly mention that, and this just came out in 2021. When we start to look at the evidence with exercise activity for older adults, we really do see that there's strong evidence to decrease some of those things that we want to hopefully avoid as we get older. I can't take credit for this phrase. This is from two PTs, Dustin Johnson and Christina Previtt. They basically say you're either an older adult or you're an older adult in training. And so that's why it's so important to, pay attention to the exercise and the activity. And we see that there's strong evidence to decrease cognitive decline, frailty, decreased sarcopenia, which is muscle wasting, falls, and impaired mobility. The other thing that this paper brought about is just some general recommendations. So, if I would ask in the chat, and for time's sake, I'm not going to do that. Like, what are some of your barriers to being more active or to exercising more? One of the more common ones is lack of time. It could be lack of knowledge of how to do it, lack of resources, not liking it. And so when you think about the exercise activity recommendations, we really want to try to individualize and personalize these activities, these exercises, so we can increase the adherence. Maybe it's making it practical for the person versus, getting on a treadmill, that doesn't work. Well, maybe it's walking around the neighborhood or walking the dog, whatever that activity, whatever that movement might be. And then this last one, being multimodal or multi-component, those are just the different aspects of it. If it's strength training from lifting weights, balance activity, that cardiorespiratory aerobic activity, flexibility, all those are important. But that can become a little overwhelming, especially if you're a novice to exercise. And so one way to think about that is just this rise and shine model. And you think, well, what does it take to get me out of bed in the morning? Well, it takes a bit of strength because I have to stand up. And so think about some things you might do to increase your strength. Well, once you're standing, well, I got to have balance to maintain my standing. And so then maybe you want to do some balance activities. Well, then once you have your balance, then what does it take to get around and do things in my house or in the community? Well, that's where that cardiorespiratory, that aerobic capacity comes in. And so it might just be a way you can kind of structure or prioritize the different components of exercise. The next couple slides here just kind of summarize that article I mentioned earlier. This is mainly just kind of an FYI. I'm not going to go into it in detail, just to kind of talk about the broad categories with this. When it comes to strengthening, we're really starting to see that this high intensity is feasible, safe, and effective for older adults. And so we might want to think about multi-joint exercises that target muscle groups versus very specific, like the bicep curl is very specific versus a chest press or a latissimus pull down targets many groups. Now, if you see here that, a high intensity is better than moderate intensity, that's true, but what we're not recommending is if you're a novice person and you're not used to doing this, we're not recommending that you go out and you're like, okay, I need to do 3 sets at 90% intensity for 12 reps. Because if you do that, you might get hurt, number one. Number two, the next day you're going to be really, really sore and you're probably not going to want to exercise again. And so it's important to, if this is brand new to you, is to start maybe at 40 or 50% of an effort for one set of 8 repetitions. Do that for a week or two, and you can gradually build up your intensity to tolerate the higher intensity. Another category that sometimes gets overlooked is power training. And power training is similar to strength training, except now we have a time component to it. We tend to like to do things that are kind of our self-selected pace, but the power component makes us do things a little faster, still safe. And we need that when, let's say, we're rushing to the bathroom, or we've stumbled a little bit and we need to recover from the stumble, or if we need to get across the street a little quickly because the light is changing. And so it's important to, if you're comfortable doing some strength training, then maybe start to think about a time component so you can add that power component to it, because power decreases faster with age than strength alone does. The other categories we've talked about is the cardiorespiratory. There's that walking ability. That's a strong predictor of survival in older adults. When we think about different ways we can do aerobic or walking, this is the variety, is the spice of life. So maybe it's changing pace, maybe it's changing directions, step ups, doing stairs, doing hills, If this is new to you, then maybe it's 1 minute, maybe it's at 5 minutes, and you kind of gradually build up to 15 to 30 minutes on that. And then we also talked about balance. And so again, it's great that it's included there with older adults, but we really want to think about different ways we maybe can incorporate balance training when we're an older adult in training. Maybe that's through yoga or Tai Chi. I've given some strategies here, basic ones of, having 2 points of support to 1 point, 1 finger to none. There's a component with your visual. You can do things with your eyes open or your eyes closed. If you're standing on a firm surface versus maybe rolling up or folding up some bath towels to make it a little less stable. If you want to throw in a cognitive challenge, you could do a dual task activity. There's starting to be some really good research with that. And it might be start at 63 and count backwards by 7 while you're doing a balance activity. And then static versus dynamic. Static, you're trying to stand as steady as you can. Dynamic might be, taking steps forward and backwards and sideways. And, maybe think about how you can incorporate this into different parts of your life. Maybe when you're brushing your teeth. In my neighborhood, that I've seen a walker every once in a while that will, start to walk on the curb, and some different challenges just to kind of, push it just a little bit. We still want you to be as safe as you, or as independent as you safely can. So you need to be mindful of that. But we really want to kind of work on that edge where you're really trying to tax those systems to kind of that whole use it or lose it principle. Again, this is that the guidelines. And so I wanted to include a couple tables in here from that same article. Again, not going to go into this into detail, but this is just the general exercise recommendation for older adults. And they kind of break it up into resistance training, aerobic exercise training, or that cardiorespiratory, as well as balance training. And so I just wanted that to be in your handouts. And then the next one looks at some common syndromes or conditions that older adults may have. Maybe it's that frailty or that sarcopenia, which is that muscle wasting, falls or decreased mobility, and then that cognitive impairment that we talked about earlier. So that's going to be in your handouts. I also wanted to kind of mention some of the common chronic conditions for older adults. And, if you look at the top line here, hypertension, high cholesterol, I've circled arthritis, heart disease, diabetes. These are the common chronic conditions that we see in older adults, and some of us may be on medications for some or more than these. But specific to arthritis, there's a lot of recommendations that exercise is important and can help improve mobility. So from the American College of Rheumatology, I've highlighted the aerobic and strengthening being beneficial. Over the European League has shown that exercise positively impacts pain. For those who may be dealing with arthritis and maybe aquatics or like swimming growing up, a lot of times there'll be community pools that are available. Hopefully, some of those are now opening up a little bit more since we've relaxed some of the COVID restrictions. I know over the past year or two, a lot of those have had closed down or had limitations of people who could participate. Just super quick, this is a lot of information, but I just wanted to highlight the few things that were just on that slide we just talked about: the high blood pressure, the arthritis, the heart disease, and how beneficial these physical activity guidelines can be at lowering the risk or even reducing the impact if you already have those. Again, dementia, cognition, balance, improved sleep, improved bone health. It really is something that we need to be prescribing more across the whole age, not just with older adults. But unfortunately, 80% of US adults are insufficiently active. So hopefully we can start, moving the needle on that a little bit and changing that a little bit there. So there are some things to consider as we are not as young as we used to be. Warming up. So typically you need a little more warm up time as you get a little bit older, especially if you are doing something at a higher intensity, especially if you're recovering from an injury. So be mindful of that. some strategies you might think about. So let's say you have been exercising and you're kind of looking at ways to kind of vary it up a little bit. Again, I always like presenting on this because I kind of end up reminding myself like, oh yeah, I need to start changing some things up a little bit. If you're familiar with CrossFit, you may be familiar with these acronyms. EMOM is every minute on the minute, and AMRAP is as many reps as possible. And so a way you could vary your workout routine, let's say you are, on an exercise bike or a treadmill, is every minute you're going to go at a higher intensity. Maybe it's for 20 seconds, maybe it's for 30 seconds, maybe it's for 40 seconds. And then you hit a rest interval until you hit the top of the minute again. And then you repeat. And so maybe at first you just do 3 rounds of that because it's new to you. Maybe you work your way up to 10 rounds of that. So you could get on your treadmill, your bike, and for 5 minutes, you could warm up. You could do 10 minutes of a every minute on the minute routine. And then you could cool down for 5 minutes and you've got a 20-minute workout in there. As many reps as possible might be something, you could see it with push-ups. You could even see it doing, sit to stands from a chair. I talked about different ways you can kind of work exercise or activity into your daily life. Maybe try to get out of the chair without pushing on the armrest if that's where you are in your fitness level, to try to increase your strength. And then if you're able to do that, maybe see how many repetitions you can get, as many reps as possible, maybe in a row, or maybe within a 30-second block or a 60-second block, because once you start adding that power component, that time component, not only do you get the strength benefit, you're starting to get an endurance component as well. And so again, it's that kind of that more bang for your buck. If you're doing, an exercise that works multiple joints, multiple muscle groups, you're getting more bang for your buck versus just, an exercise that's only focusing on one. This next one is a speed workout that, I'll kind of do with some of my running workouts. And I kind of like it. I kind of like it because it not only has distances on here, so sometimes that works for me, but if I'm just running in the neighborhood, then the time component works well. And so this number 2 is basically an every minute on the minute. So you do 16 rounds of 30 seconds where you go fast and you either jog or walk for 30 seconds, and you repeat that 16 times. So if you have, a little bit of a warm up, do that, which is equivalent to 16 minutes, and then, 5-minute cool down. Again, you're starting to increase the amount of time that you're doing your activity, and you're working at a higher intensity, which we know we're getting some better benefit from. Other ways that you can kind of maybe increase your adherence is, think about different sports drills you did growing up when you played soccer or basketball or whatever sport it is. That causes you to change directions, work on your agility, your balance, your coordination. Right now I'm working with a patient, and we're basically it reminds me of doing defensive drills growing up playing basketball. I have her at her kitchen counter, and we, as fast as she can, we shuffle along from side to side. So we're getting a little bit of that, time speed component. It's changing directions for her as well. And so I think there's a lot of benefit with that. And then, Hanover College, close to Louisville, I just wanted to throw something in with Muhammad Ali. So, jump rope may be something that you enjoyed. Maybe you can still do it. But even if you can't, if you think about, the components, if you're not even using the ropes, can you do little jumps in a row, maybe 10 in a row or maybe 20 in a row? Because we know when we look at bone health that stimulates the bone, and if there's not another reason you shouldn't be doing that, you could get some benefit from that. Maybe it's hopping from side to side just a little bit, so you get a little bit of lateral movement in there. And so there's different variations that you can get in there. So it looks like we're getting about 25 after, so I'm going to start wrapping things up. So these are the things that we kind of covered. I did want to go through each one more time. So when we look at properly dosed exercise being medicine, I just wanted to point out the Lift More trial. So with the Lift More trial, they looked specifically, and this is specific to women, but I think they also had an arm that looked at men as well. But they did 8 months of 2 times a week, 30 minutes of high intensity resistance impact training, 5 sets, 5 repetitions, and they did 85 plus intensity of 1 rep max. And they actually, when they compared it to the control group who didn't do these, they had improved bone mineral density, they had decreased falls, and so all the metrics that we want as we get older improved. And this next one here is, I think it's still in review. I don't think it's been published yet, but they're starting to roll out some of the information. This is, if you're familiar with kettlebell, this is a kettlebell trial. And so in this one, the previous one was women with osteoporosis, osteopenia. This one is healthy older adults. So they did not include people who had some pre-existing condition, although I think that's the next phase for them. And what's nice about this is they made weeks 1 and 2 easier, lower intensity, because this was a group of people that were not familiar with doing kettlebell training. With kettlebell training, for those who are familiar, these exercises may sound familiar: Russian swing, clean military press, goblet squat. So with that, they started to increase the intensity at week 3, and then anytime that the person felt that it was starting to get a little too easy, they could increase the intensity on their own by increasing the weight of the kettlebell that they're using. So by starting easier with week 1 and 2, they decreased the likelihood of that muscle soreness. And then when they looked at, how many times you can get up from a chair in 30 seconds, they had improvements of over 20%. They looked at doing a floor transfer test, so that improved by 15%. Because the people were kind of working at it as a group, they kind of had the built-in sense of community. So they actually had pretty good adherence rates for this as well. So properly dosed exercise is medicine. This is a zoomed in slide of something is better than nothing. And so again, you see that doing something, you actually have the biggest benefits, because that line is so steep right there. And then the moderate intensity is beneficial as well with that. And then variety is the spice of life. Think about that multi-component activity, that muscle strengthening. Remember the power component, that time component. Remember balance training, aerobic training, all those are important. And then, are you doing different directions when you walk, different coordination? Do you need to make it functional? Getting up and down off the floor, there's an exercise called the Turkish Get Up with a kettlebell. You have to start in standing and you end up on the floor, and then you return to standing. But even if you're just practicing going from being upright down to the floor and back up, that for some people, that is the appropriate intensity for you, and it's very functional as well. Again, we talked a lot about high intensity versus low intensity. The higher intensity, the research is showing increased muscle strength, bone strength and density, walking speed. That's important because you're reducing fall risk, decreasing osteopenia and porosis, decreasing disability, and that ultimately will improve your function as well as your independence with that. So, I kind of like to end on this slide, and I'm going to have to adjust something real quick. There we go. Aging is inevitable, but how do you picture how you want the aging to be? So this is Nimble Will Nomad, who just recently in 2021 at 83 became the oldest person to complete the 2100 mile Appalachian Trail, or Julia Hurricane Hawkins, who at 101 set the 100-meter dash record for her age group at just under 40 seconds. And at 105, was disappointed that she didn't break 1 minute when she got 63 seconds on the 100-meter dash. Or Ed Whitlock, who unfortunately is no longer with us, but he was the first person to run a sub 3-hour marathon at 70. And then the oldest person at 85 to run a sub 4-hour marathon. And then Willie Murphy, who's an 81-year-old power lifter who holds national records for her age group. All right, I made it. It's 5:29. I'm gonna pause the recording real quick, or stop the recording real quick, and see what's questions.